Hi everyone, I'm Dr. Bauer. I'm a physical therapist here at RunLab in Austin, Texas, and today I'm going to talk about chronic ankle sprains, running, and why those two things might be related. So if you're someone who's had chronic ankle sprains in the past, it's just something that keeps happening and you're not sure why, this is the talk for you. So we're going to start here by going over a little bit of anatomy. This is our foot model. You can see the foot is in front here. We've got the tibia here, which takes up about 80 to 90% of weight bearing, the fibula, which makes up about 10 to 20% of weight bearing. And then we've got the talus, and these three structures make up the ankle joint. So as we go through our running motion, we go through a series of motions called dorsiflexion and plantar flexion. So as we accept weight, we are typically in what we call dorsiflexion, which is this motion. And then as we push off, we go through plantar flexion. Now, these motions are important because the way that this talus is shaped, it's a wedge. So it's large in the front and rather narrow or small in the back. So as we're going through dorsiflexion, that large end of that wedge in the front pushes up into these two bones, making it more stable. When we go into what's called plantar flexion, we push down here, and that small end of the wedge is in the joint space now. So in dorsiflexion, the motion that happens at the ankle is minimal, and it's mostly happening at the foot. In plantar flexion, we have a lot more motion here at the ankle joint itself, as well as the foot. So as we're going through our motion here, the foot is more stable in that dorsiflex position, a little bit less stable in the plantar flex position. So a typical ankle sprain happens when the bones fail to stop that motion. So when we sprain our ankle, it's usually an inversion sprain, which is this direction, and you'll see why this bone right here sits a lot higher than this one does here. So guess what? When we go that way, we're hitting that bony block. When we go this way, it doesn't stop that motion quite as much. So we have to rely on the ligaments that sit around the ankle over here. The most common one is called the ATF, or the anterior talofibular ligament, and that is the first ligament to tear during a typical ankle sprain. And when that tears, that's when we get that bruising and that swelling that we normally associate with a typical ankle sprain. So why is this important, and how is that going to affect how you run? One, mechanics play a huge factor. So if we're landing, most people are either a rear foot striker or a midfoot striker. A very small percentage, and it's probably about 5 to 10% of people, land on their forefoot. And that's totally fine if that's how you run, except it's going to predispose you to getting those ankle sprains frequently. Why? Because, as we discussed before, when we're in that plantar flex position, it has more room to move at the ankle. So if you're on flat ground, it's completely fine. But if you're stepping on rocks or something uneven, like stepping on a curb, you're just going to be in a more predisposed position to sprain that ankle. So getting you to land either with a flat foot or a little bit on the rear foot is going to make that ankle inherently more stable than if we're up on our toes. So mechanics are half of the battle, but the other half is making sure that our muscles are strong. So a lot of people, who go out and trail run frequently, they have strong muscles around their ankle because their body's just used to those stresses. If you're not used to that, you have weak muscles around your ankle, guess what? We lost our safety net, because if the bones aren't stopping our movement, the ligaments are going to be the ones that are going to tear. The muscles are going to be able to slow down that movement so that we don't get to the point where those ligaments are tearing. So if your muscles are weak or you have poor proprioception and control of your foot and ankle, you're going to be more prone to sprain those ligaments. So what we do in here, we work on people's mechanics, getting them to land in a good position, making sure they're not too much on their toes, especially if they're a trail runner. The other thing that we work on is challenge their balance a lot. Standing on a balance board, a foam pad, anything unstable, and we try and make it more difficult in here than what you're going to see in the real world, so that your body is ready to take on those challenges, especially when they're unexpected. So if you are dealing with chronic ankle sprains and you're not sure why, and you really just don't know where to go next, come and check us out, follow the link below, and we'd be happy to help you out.